In light of recent events, many people are talking about American healthcare. But people have been talking about American healthcare. Since 1912, when the first health insurance policies were introduced, it has been a topic of much debate. After 1912, there were several other things that were proposed, policies, ideas, but because of World War I, none of them were passed. In the 20s and 30s, there were other health insurance policies that passed and expired for health insurance for children, but it wasn't until the 40s that health insurance became a requirement. In 1943, there was even a proposal for universal health care, the Wagner-Murray-Dingle Bill, but this was cast aside. By the 1960s, there had been other various bills that had been proposed and cast aside. In 1965, Medicaid and Medicare were passed, and these still exist today, providing health insurance for millions of Americans. In 2010, Obama took action in the health insurance field. He signed the Patient Protection and Affordable Care Act, which not only expanded Medicaid, but also required all people to have health insurance by 2014. Those who were not provided health insurance by their employers could purchase it with government subsidies, and businesses that did not provide it would be penalized. The age in which young people could remain on their parents' plan was raised to 26. When discussing the healthcare system in America, the idea of universal healthcare is often brought up. The idea that it's the government's job to provide its citizens with health insurance, that nobody should go without basic necessities simply because they cannot afford them. But why bother with that, right? This is America. Competition breeds innovation, right? If you just give people handouts, they won't do any work, right? In 2021, the life expectancy in America was 71. It has been going down for quite some time. For a country as large and wealthy as America, 71 is not great. For perspective, the life expectancy in Norway is 83. In Sweden, 82. In Germany, 80. New Zealand, 82. In Australia, 83. In Canada, 81. In Denmark, 81. In Italy, 82. In Japan, 84. In France, 82. All of these countries have universal health care, which means none of its citizens have to pay out of pocket for care that they need. It means the government provides that. It means none of them have medical debt. In 2021, American citizens owed $220 million in medical debt, which is money that a patient does not have for care that they need. 17.8% of Americans said that they owed medical debt. And this may seem like a rather small percentage, but that is still 5,081,000 people. The largest provider for health insurance in America is United Health Group. They serve 148 million people. In 2024, they made $339 billion. Elevance Health served 115 million people, and they made $44.7 billion. Cigna Health serves 20 million people, and they made $63.4 billion. These companies are not built to serve the people they represent. They are built to make money. It is about money. It is always about making money. These corporations don't care about you. They don't care about the things that they provide. They care about making money. The second most common reason for an insurance claim denial is if your doctor recommends you something that you need, perhaps, and your insurance company says, no, do something cheaper. We're not going to pay for that. Like, for instance, if you were to go to a cancer screening and your doctor found something, not cancer per se, but something, and recommended you get a screening a little more often than the 10 years that is recommended. And your insurance company says, no, there's not enough evidence. We're not going to cover that. You have to pay for that out of pocket. Or perhaps you seek a treatment that is outside of your insurance company's network. They don't necessarily have to cover that, even if it is something that you need. 1 in 5 in-network claims made to major insurance companies were denied in 2024. I spent a while trying to find the exact percentage, but it's a little bit more complicated than that. It can vary immensely between whether or not you're privately insured or not, and even then, it's a little more complicated. But according to US News, 17% of all claims were denied. But that number varied immensely between 2 and 49% depending on who you were insured by. Employee-based insurance was the most common to deny a claim, their study found. These numbers have been going up over the last few decades, and so too, like everything, has the price in medical care. What was once an inconvenience can now bankrupt someone, digging them into a financial hole in which there is no recovery. Medical charges being the number one reason for a private citizen to file for bankruptcy. This system is broken. It has been from the start. What I have told you is a list of facts, a list of statistics that anyone can find. I am not the only one talking about this. This has been an issue for a very long time. So you find yourself asking, why hasn't anything changed? Why is this still such a big problem? Because it's not profitable. Because private companies profit from this system. Because it keeps the rich rich and the poor poor. A study done in 2018 about universal healthcare systems implemented in Mexico in 2000 found that after the system was implemented, there was an increase amongst the poor to seek preventative measures for common diseases such as diabetes and cervical cancer. When there was no threat of financial burdens, people were incentivized to seek preventative measures, meaning that if any issue was found, it could be easily treated, meaning that the population as a whole would become healthier. According to the CDC, nearly 60% of Americans suffer from a chronic disease or condition. Chronic disease can be debilitating, making it very difficult for someone to work. Chronic issues like these are the leading cause of healthcare costs. In 2016, the total spent on chronic disease treatment was nearly $1 trillion. To quote the CDC, if lost economic productivity is also considered, the total cost of chronic disease increases to $3.7 trillion, which is close to 1/5 of the entire US economy. These costs are predicted to go up in the next couple of years, and it is not because these conditions are untreatable, non-preventable. There are things you can do for all of the chronic diseases listed by the CDC, or to catch them early, which is the best thing you can do to stop things like heart disease, cancer, chronic lung disease, stroke, Alzheimer's disease, diabetes, and chronic kidney disease. In their 2019 study, the CDC asked many experts on preventative care why only 8% of Americans over 35 sought such measures. The top answer they received was financial burdens. All participants said that financial and economic considerations were the reasons they didn't seek preventative measures. Another reason being there is no financial incentive for preventative care. Providers are not paid more if their patients are doing better. However, they are required to rate the progress of such patients, and there are so many measurements and tiny little things that need to be done, and not all of these always reflect what is actually happening, which means that the providers get weighed down in all of these details and little things they have to do, and not all of them really say what's going on. So this sort of removes any incentive for anyone to seek preventative measures. What their study found boils down to this quote: "A major reason the implementation gap exists is because financial incentives do not align with a focus on preventing chronic diseases. Currently, most providers, including hospitals and physicians, are paid to treat rather than prevent diseases. This method is more profitable for insurance companies. They make more money the more issues arise. This has been systemically set up to make as much profit as possible. But should we be surprised that this is how it works in America? No. This is how everything works in America. It is always about money. Everything is about making money. As I said before, this has been on the docket of discussion for decades. Obama tried to fix it, Biden tried to fix it, Trump did something. But despite this, the issues still prevail just as badly as they have forever. Now, I learned a lot while making this video, and what I've told you today is surface level. I could have sat here and talked for hours about the issues with American healthcare, but I don't want to do that. I want to talk about something else. Luigi Mangione. On December 4th, a man was murdered. Brian Thompson, the CEO of United Healthcare. He was shot on his way to work in the early hours of Wednesday morning. This was a terrible act of violence, but that's not what I want to talk about. I don't want to talk about the act. I want to talk about the public response. Almost immediately, people were praising this act, praising the man who did it. People all over the internet talking about how great this was, how timely, how necessary. A man was killed, slaughtered, as he walked along the street. And people praised the man who did it like a saint. People immediately understood why someone would do this. People immediately understood why someone would do this. And on the news, they said over and over again how shocking, how terrible this crime was, how awful and atrocious this violent act was, how disgusting and disturbing that people seemed to love the man who did it. That people understood and related to why he would. How crazy and insane it seemed that this could ever even happen. How unexpected it was that people celebrated the man who did this. Luigi Mangione was charged with 11 charges, including 3 charges of murder, terrorism, stalking, using and firing a firearm equipped with a silencer. All of these combined could get him life in prison, but because he was also federally charged with first-degree murder, he could get the death penalty. This case was widely publicized. It has been talked about over and over again. People act like this couldn't have happened. Like it was some huge surprise. But it really should not have been. We should be less surprised that it happened and more surprised that it hasn't happened before. There is a line. There is a line on how far you can push people, and people have been angry about the healthcare system. People now feel vindicated in their rage, and it really should not have come as a shock that they reacted the way they did to this crime. Now, there is one more thing I would like to point out. When this first happened, I saw all of those videos praising Luigi. I saw all those people saying over and over again that this was a wake-up call. And in those videos, when they talked about who needed to wake up, they never just said healthcare CEOs. They said CEOs, or the uber wealthy. Now I know my channel is small. My videos don't get many views, and I know the people I ask this will never see it, but I have a question. For the CEOs, for the wealthy, for the 1%, fear is a powerful emotion, a double-edged sword for both change and oppression. I have a question. Are you afraid? And I know your initial response, no, of course not. What do I have to be afraid of? And this answer will seem adequate in the light of day, surrounded by your yes men, but I ask you again. Are you afraid? In the dead of night, alone, when you're thinking about your life and your children and all the choices that you've made and all the things that you've done, are you afraid?